And now I'm going to perform the surgical hand scrub. Surgical hand scrub is a procedure on which help to remove microorganisms from our hands and for arms in our arms. Then its purpose is, of course, to remove the microorganism and to prevent the transfer of microorganism to our patient. So gather all the equipments needed, like the sink. Here, the sink with the faucet and uh, the hand soap, and I have here the surgical brush used to clean our hands later. So so to start, um, so assuming this is the sink, the real one. So kamay siya kung klaro. So that, so turn on the faucet. So I used my foot to turn on. So this is actually the faucet we use in the hospital. Then I turn on, then wet your hands. So wet your hands. Apply soap. So assuming that I have already the soap, so I'm gonna apply the soap here, and then sa ako sa ning i-wash. Then so apply soap. So remember the hand washing technique. So first rub like this, and then here, then palm to palm like this, then like that, then here, down here to the elbow, then rinse. So assuming ako na ni siyang gi-rinse, there is akong water. Then so your hands is now clean. So now we use the surgical brush. So this is the surgical brush. So this is the real surgical brush. Here. So used to clean the nails, all the nails. Even if your nails is clean, you should tusoko ay mong kuan hinluan each nails. Kaya na din na ang mga wala nimo nakita nga mga kuan hugaw. Abi nagtaas imong kuan. And remember that remove first all the jewelry, because jewelry can transmit kuan microorganism to our patient. So then, so drop this one. Then when using the surgical hand brush, so like this, apply sa nimo ang kuan. So yeah. Then each fingers, brush on each fingers. In the other side. Down here. Down here. And then also here. Also here. Then drop. Then rinse. Remember that your hands is above the elbow. So ang elbow down siya para ini rinse. Okay? So danang suot man day ko ukuan. Ang suot man day ko. Hindi man ako okay. Before to perform hand washing, you should wear the bonnet, face mask, then the shoe cover, then perform the hand washing. So wet your hands, wet, then apply hand soap. So I will apply hand soap here. Then wet, rub. So ako na baston na may hand soap. So like this, yung hand washing. Remember the hand washing technique. Then right here, in here, and then down to the elbow. Then rinse pa, down, rinse pa, again. So surgical brush. So we have here the surgical brush. So clean the nails, each nails. Kaya andyan yung mga microorganism nagtatago. And then drop the, then when brushing, so apply the detergent soap. At sa kailangan ni siya mura mubula naman ni siya automatic, so mag-apply sa kaukuan sa imong kamot na report na para mubula siya. Kaya diretso ka o gamit sa brush, siya mubula, so useless. So in brushing, brush each fingers. Brush the hands. In scrub the fingers with 15 stroke na siya each. Then na dayon sa arms till there is sa elbow. Sa elbow na. Okay, then rinse. In rinsing, here first. Ano sa ang first dali? Slowly. Then up. Remember that the elbow, our hands is above the elbow. So assuming na kuha na ni siya. Again, ana like that. Then actually ako na ning after rinsing, you can enter to the major room, sa sterile room na. So pick up the, so when entering after rinsing, nag-rinse naman ka daw, so your hands is always like this, naka-up ra siya, nakalingaw. So assuming na naka sa room, so pick up, so do not touch your hands to the table, ana. Then you can pick one. Your one hand will pick the sterile towel. This is the sterile towel. So you use the sterile towel to dry your hand. So like this. Then dry in rotating motion from the cleanest to the less. Repeat drying from other hand. So ana na siya. So dire. Dry, then rotating motion. Ana na yun. Then discard towel. Discard na. The purpose of the gown is to so that the nurse can perform to the sterile area, so that the nurse can perform to close to the sterile field or area like the OR. So we should wear sterile gown. So after the scrub, done drying our hands, so grab the sterile gown. So you can touch this is the sterile gown, you can touch the kanila nga side sa pocket niya. 2 pocket man siya. So isulod atong kamot. So then step back kay mo kuan man siya, let the gown drop. So never touch the other part of the gown, only in the pocket side. Nga duha man ni ka pocket ani ug ani. So step back kay para dili siya masangko diri sa table. So, ano. Mm. So, assuming kay gamay atong area, no? So, this is wear the sleeves. So, ano. On the other side. So, let someone to close at the back. So, assuming na-close na ni siya sa back, I don't have anyone here nakauban. So, like that. So sa OR is na may someone na makahelp. So, like that. So, assuming na hikot na ni siya, ha? This is the pero ako na rin siya sa kauban ni mo, ana, i-close diri. So, assuming lang yun ni ma'am nga natagpos na ni siya sa akong kauban. Ana. So, kayo jud wala kay kauban. Sa diri sa liog hikot para dili mag kuan imong gown. Kuan ra man ni diri ipilit. Pilit ra siya. Ano na siya. So imong kuan dili ni mo ipagawas imong kamot diri sa dili siya iana. So iana ra siya. Then wear the sterile gloves. Then ako sterile gloves here, ma'am. So pick up the one. We have here the sterile gloves. So pick up the one. Sudah kayo eh. Ano? Sudah kayo. So, with your hands cover with the gown, so sapawan siya og gloves. The other side. Then adjust the fit of the gloves. Adjust the fit of the gloves. Sudah ka ayun ang trabaho ani sa UR. Oh my gosh. Adjust the fit of the gloves. Then like this. Hindi siya makuan. Wala. Nagkakuan-kuan. Adjust the fit of the gloves. Okay, you know? Arrange. So now you can touch the sterile instrument. You can arrange the table ready for the procedure, OR procedure. So you can arrange, touch the sterile area. That could be all for my hand scrub and glove and gown technique.